Welcome to the Plain English Public Health Weekly Report. I'm Richard Greenland, and today is December 23rd, 2020. As usual, we'll start with our COVID-19 statistics. Worldwide, we have about 79 million cases and over 1.7 million deaths. In the United States, we have nearly 19 million cases and nearly 335,000 deaths. The biggest news this week is that the United Kingdom is seeing a surge in a new variant of the virus that causes COVID-19. Mutations are common in viruses, but this variant called B.1.1.7 is a combination of 23 different mutations. Some people on social media are calling it COVID-20, but that would be inaccurate since it's still the same virus, it just has a few mutations. It's still too early in the life of this variant to have really solid information about it, but here's what we know about it so far. It seems to be up to 70% more contagious than the regular COVID-19 virus. It also seems to infect children much more easily than previous variants. In fact, the limited research that's been done on it seems to indicate that children can now catch and transmit that variant just as easily as adults. As of right now, most research indicates that the symptoms are the same severity, but a different variant in South Africa that has some similarities to the B.1.1.7 variant is causing more severe symptoms. So after more research, we may find that this B.1.1.7 variant also causes more severe symptoms, but then again, we may not. Scientists will definitely keep an eye on it. The biggest concentration of this variant looks to be in the UK, but it has also been detected in Denmark, Italy, a few other European countries, and Australia. Public health experts in the United States have stated that it is most likely here as well, but we just haven't detected it yet. The United States actually doesn't have quite as good a system for tracking variants as the UK and some other Western European countries do. So while we should be cautious about this new variant, there's no need to panic. The reason for that is that our currently available vaccines from Pfizer and Moderna should do just as good a job against this new variant because the focus of the vaccines is the spike protein, the way it gets into the cells, not the virus itself. And that part has not been mutated, at least not sufficiently to cause it to not be recognized by the vaccine. It would take a much bigger change in the virus to make the vaccines ineffective, and currently scientists don't believe that's going to happen with the COVID-19 virus. Also, the same CDC guidelines apply to this new variant as any other variant. Wearing a mask, watching your distance, and washing your hands will still reduce the spread. Also, we want to remind everyone that the CDC recommends not traveling to visit family or friends this holiday season. Please stay home. We're definitely seeing an increase in the number of cases due to Thanksgiving gatherings, and we don't want an even greater surge due to Christmas, New Year's, or any other holidays happening during this last part of the year. So please stay home. In order to help us stay home, but still stay connected to our loved ones, Zoom and Microsoft are once again eliminating time limits for using their virtual meeting software just like they did for Thanksgiving. So please make use of technology this holiday season. Thank you for watching the Plain English Public Health Weekly Report for December 23rd, 2020. As we mentioned last week, this week's report is on a different day and is much shorter because of the Christmas holiday this Friday. For the rest of the public health news from this week, please see the links below the video. I'm Richard Greenland, and you have a Merry Christmas and a healthy weekend.